Hello. It's hard to imagine January went just like that and February is now upon us. We really have had a rough January, and I want to thank all of you for the tremendous support, whether I'm in the ShopRite or in the church. You all have been watching the videos and shared with me your support of our teams, and I really appreciate that, and it means so, so much to them. 6.4 million New Jerseyans are fully vaccinated as of this week. We are seeing our transmission rate go down, and that is very good news, but I want to caution our hospitals are still very, very busy. And we know that we expect to continue to be busy for the next few weeks as we move forward. Our COVID numbers have, I would say, stabilized. They've gone down. We're under 200 at this point, but it's right under, and we go up and down every single day. And we watch those things just like you would watch your blood pressure monitor, because that's how important it is that we stay absolutely on top of those things. I'm thrilled to let you know that our staff is well and coming back to work for those who had been impacted by Omicron. And so, again, all of that is very helpful. The COVID numbers are one piece of the equation for a hospital, but the other folks who are just generally sick as part of the normal things that happen in this busy time of the year for us. This is our busy season, if you will. Our non-COVID patients are significant. And so again, I ask you for your patience as we continue to work through the emergency room access issues, as well as our physicians' offices. So obviously we still have our vaccine clinics available, and the hours are on the screen above. You can see all of those. I'm so thrilled that we continue to offer our outreach on Wednesdays. This week we were at Taylor Farms. You'll remember from the summer probably that we talked about Taylor Farms because we went out and vaccinated over 100 employees, and they had 70 different dialects that they spoke. So we took our translation system from the hospital with us out there, and it just did a great job of making sure everybody had informed consent, and we were able to communicate that way. And we did it again as part of the boosters, again vaccinating over 100 people, and we're really grateful for Taylor Farms. Obviously, if you have an organization or if you're an employer, please contact us. We'll be glad to make that available to you as well. So sometimes I get depressed because often the only letters I get are letters of complaint that people don't get in fast enough or the experience wasn't what they want. But I got a handwritten letter from Christine Pantelis about her experience. She had first written to me when her dad had come in to the vaccine clinic and had his first set of vaccines. He was recently in the hospital over Christmas, and she wrote a 7-page letter telling me about everybody that she came in contact with, whether it was the registration staff or even on the exit, the transporters, just about the way that they cared for her dad and the way that he kept her informed. Obviously, we've talked about we still are under red rules as I'm taping this. That could change, but that is tremendously stressful for families and for the patient not being able to have their loved one right there. But she, again, described in great detail the things that we did, the things that really mattered, and it really is helpful for us, to celebrate our team members who do such great work, but also to give us the tools to be able to train on to make sure that we can do that for others. So I just want to thank Christine for her generosity in taking the time to share this, and also to her dad for allowing us to care for him. We do treasure those things, and especially at 95, we know how important it is to make sure that we are holding his hand through every step in this process. So I'm thrilled to announce that Dr. Scott Wagner has been appointed the president of the Inspira Medical Group. Scott has a long history with us, starting out at Inspira Vineland Emergency Room, worked as the leader, not only serving in the emergency room, but also as the leader of that group, has gone on to serve as chief medical officer at Mullica Hill for the last 2 years, and we are thrilled that he is taking on this new challenge and will be working with all our employed physicians. Thank you, Scott. We're so thrilled to walk this journey with you as you continue in your career, and we're sure that you will be tremendously successful. Until we meet again, be well and stay safe.